We are joined this morning by MMC Hospital Doctor, Obstetrics and Gynecology Specialist, Dr. Kencana Shinta Moser. Good morning, Dr. Shinta.
Morning, Doc.
Good morning. Good morning and happy Kartini Day.
Yes.
Happy Kartini Day to you too, Dr. Shinta.
Yes, you look very beautiful.
Oh, thank you so much,
Thank you.
Dr.
No, I'm just
Shinta.
Yeah.
Yes, so this is very exciting announcement, right, Dr. Shinta? The Indonesian
Yes.
government has made
Yes, very
HPV
true
vaccine for
indeed.
girls and hopefully for
Yes,
all
I'm
women
very
actually,
happy.
free and mandatory. So what's your thoughts on this government plan?
I am very happy about it because actually cervical cancer can be prevented, and this is still the second leading cause of death caused by cancer in Indonesia. So hopefully with this vaccination, we can reduce the mortality rate of the cervical cancer. As we know, the cervical cancer is caused by human papillomavirus, which is transmitted sexually. And normally, it takes a very long way to be a cancer. 90%, if we are already sexually active, then we have the risk to get the HPV infection. Normally, the infection will clear up by itself 90% within 2 years. But if our immunity system is not good, it can go to cervical cancer, but it still takes 3 to 17 years.
Oh, wow.
So, and then it can be detected in an early phase, and if we detect it in an early phase, we can cure it for 100%. And with the vaccination, it will reduce the incidence. I mean, it is very sad. I had a patient with 33 years old, and she had cervical cancer, and the children are still very small. Can you imagine how devastating it is? I mean, yes, I'm very happy that finally the government already gave the vaccination to as a mandatory.
Doc, so how effective
Yes.
is the vaccine? You did say that getting the vaccine will greatly reduce the risk. Does it guarantee one that once they get the vaccine that they'll be free or protected from HPV, or is it just how much of a reduction of a risk is it?
Okay, the vaccine can reduce until 90%, but it doesn't mean that you have a guarantee that you will not get the cervix. I mean, there is no guarantee for 100%. That's why, even though you already vaccinated, you still have to do the screening test, pap smear.
Right.
So, with the first prevention is the vaccination that is given. Normally, it should be best given in the children because their immunity is still very good, and then if they are vaccinated, the antibodies also produced in a very well amount. The antibody will be very good as well. And then after that, the second prevention is that you do the pap smear once you're already sexually active.
Once we're sexually active.
Yes.
Okay, vaccination on children, on girls, little girls.
Yes.
How old should they be to receive vaccination, HPV vaccination?
Okay, the youngest is 9 years old, but and then it can, and also when you're still a child, it can be given only 2 times. And then the interval is about 6 months. The first dose and then the second dose can be given 6 months until 12 months apart. But if you're already 15 years old or more, if you're already more than 15 years old, it should be given 3 times.
Oh, 3
So you
times.
have to get the 3 doses, just like first dose is now, and then second dose is 1 month or 2 months later, and then the third dose will be given 6 months after the first dose.
Right. So, doctor, I received my HPV vaccine probably about 10 to 12 years ago. Do I need a top up?
Yes.
Because I'm feeling a little bit insecure.
And a booster?
Don't be insecure. You don't need a booster at the moment. The study shows that you still don't need you don't need a booster
Okay.
at the moment.
So it's for
Yeah.
life, right?
It's for life, yes.
Okay, so
Yes, at the moment, yes.
okay, Doc, could you break down a little bit how cervical cancer works? We do know with other forms of cancer, it can go into remission, but then you can relapse from it or it can return. How about those who have already gotten cervical cancer in the past? Should they be vaccinated, and how does that work?
The vaccination is given before you have the cervical cancer, yeah.
Okay.
But if you already have the cervical cancer, then it's not given.
Okay,
Okay, right. And you
So
mentioned
it's better to prevent.
right.
it's better to prevent. Speaking of prevention,
Yes, of
doctor,
course.
you also mentioned about pap smear. How often should women do this?
All right. The pap smear should be done at least 3 years after you're sexually active. And then, if your pap test result is okay, there is no abnormality, then you can do it every 3 years. Now we have the HPV DNA. If you combine between the pap test and the HPV DNA testing, so you can do it in 5 years' time.
In 5 years' time, okay. Is it?
Yeah.
My producer told me that you probably want to show a pap smear process, what
Oh,
it's like.
sure. Many women, many women are afraid of having a pap test.
Yes.
They are very afraid that it will hurt. They are very afraid of the result. But
Right.
I tell you, please do not be afraid, because just like cervical, the pap test is to detect the cervical cancer, and if it is found in the early stage, then it can be cured 100%. You don't have to be worried. Here you have the film how it should be done. So you lay down there, and then your leg will be spread apart. I mean, I know it is a very what is it that the most intimate part of your body is being exposed, but it's okay. Yeah, I mean, it's okay. And then we will insert the speculum. This is, we call it cocor bebek. Yeah.
Cocor bebek, yeah.
It is quite small. You can ask the doctor, get the small one for me. I mean, and then just relax. This one is to open the vaginal wall, just like this.
Yeah.
And then we just insert it so that I can see the inside of the vagina, because cervix is inside. Yeah. It won't hurt. And then after we see the cervix, then we do the just this is the cervix. I put very fast, and then this one like this. Then
That's it.
Oh,
It's
okay.
actually less than 5 seconds.
Yes,
Oh, okay.
sometimes. No, it is very fast. But just like many of my patients who are also afraid. I mean, just relax. And some of them, I'm not ready. Doc, can I come back next time? Okay, but please do it.
Yeah, no, I didn't know anything about how
Yes,
pap smear is done, but I've always heard women saying how they're very afraid to do this process.
Really?
Yeah,
Isn't that
Yeah.
interesting?
Yeah, because of pain. Usually, that's what most people
Oh,
say.
it's actually not painful. I mean, it's like I've done it before, you know,
Yes.
to of course maintain my health, to make sure that everything is okay down there.
Right.
But you know, it's like I think maybe I can share a little bit of the tip, doctor, to help you. So we do need to relax.
Okay. It
Because-
makes it more difficult.
Yeah, because if
Very
we're
true
afraid, we
indeed.
tense up. And when we tense up, the
Yes.
area down there is also tensing up. So it's harder for the doctor to actually open it with a speculum. So what I do is
Very
usually I
true.
just breathe.
Okay.
I just do like deep
Yes.
breathing, and so that when you do deep breathing, immediately your body just relaxes. Everything in your body
Very
just
true.
relaxes.
Very true.
How often
I
should
agree
this
with
be
you.
done, Doc? Ideally.
Okay. If the result is okay, if the result is negative, it's normal. You can do it 3 years later.
Oh,
And
wow,
if
not
you
even
combine
often.
it with the HPV diet, the HPV DNA testing,
Okay.
you can do it in 5 years later.
Oh, that's
Yeah.
great. That's fine.
Don't be afraid. I mean, and don't be afraid about the result. Many of women are afraid to take the pap smear because I'm afraid about the result. I mean,
Right.
the incubation takes a very long time, so don't be worried. I mean, and if we can detect it in the early stage, we can cure 100%.
Yeah, that's really,
So
really important.
do not hesitate.
Okay.
Exactly.
Well, this is one
Yes.
of the steps that's very important in order for you to identify if you have anything wrong with you or any sort of signs leading to cervical cancer. But
Yes.
what are some of the
Yes, that's
factors
true.
that can lead to cervical cancer, Doc?
All right. First, it is caused by human papilloma virus, which is transmitted sexually.
Okay.
So the first prevention is the vaccination or at the early age, and then if you're already sexually active, get the screening test regularly, and then try not to have multiple sexual partner because if you have multiple sexual partner, it will increase the risk of having cervical cancer. And then do not have sex while you're still very young, just like 18 or something like that, because at that time the cervix is not enough. So if you are infected, it can go to cervical cancer very easily compared if your body is already mature.
Okay.
And then condom doesn't protect you 100% because condom is only for the penis, and then but the HPV itself is also in the scrotum, in the pubic hair, so it doesn't cover. But and then do not smoke. Smoking is not good in any kind of cancer,
Right.
and then try to live a healthy life, because be careful on what you eat, because now the food industry is very, very bad. A lot of
Processed
junk food, just like
Yes.
when I was young, there is only one pet bottle, but now there are so many kinds.
Right.
Try to give healthy things for your body, because our body is like, it's very, very sophisticated. What we eat this morning, tonight will be a part of our body, right?
You are what you
And
eat.
so, yes, you are what you eat. Just like if you want to build the house, you just choose the best material according to your budget.
Agreed.
This is for the house that you live in, but this is for our body. So try to eat healthy food, just like our body has a self-healing system. Just like every day 100 million of cells die, and then it will be replaced by 100 million of cells.
Right.
But you have to support your body so that the
Regeneration
so that
process.
it's good. So the regeneration process is good. So give beautiful good food for your body, and beautiful mind for your soul.
Oh, that's
because
always
our
good.
body, this is very important.
Dr.
And then
Shinta,
you
you're
have
so
to do-
cool.
Yeah.
I have a quick follow-up question, Doc. You did mention that this
Yes.
is one of the things to kind of lower the risk of cervical cancer is trying not to have multiple sexual partners. So how much
Yes.
more important is it for, is this going to be prioritized for the vaccines for more unmarried women as opposed to married women that are likely to only have one sexual partner?
Interesting.
Okay, as I told you before, the best is when the vaccination given at the early age. That's
Right.
what the government do.
True. Yeah.
It is given when the children is they don't have sexual intercourse,
Right.
so they don't have the exposure yet. And then the immune system is also very good, so that the antibody that is produced is also much better. But it can be given also in not only until 26 years, but in Indonesia until 56 years, 56 years old. So it can give you the protection as well, even though it's not as good as when we give it at the early
young
stage.
age.
Make sure
So
your
the
daughter in 2
protection is
years,
still
Paul.
Yeah, she'll be
9
eligible,
years.
but
Yes.
yeah.
There you go.
have a big window there.
Yeah, you will be
They will
protecting
be
your
given in
daughter
the school,
from this,
don't
which
be
is awesome.
worried.
Yeah. So, doctor, I think
Yes.
I know that this might sound like a silly question, but I just want to confirm with you whether this is correct or not. Is it true that HPV vaccination is also recommended for men? And if it is,
Yes, it's
really?
It is
What's the
also
benefit?
it is also given to boys. Yeah, because it's prevent you from the cervical cancer and also from the genital wart. The type 6 and 11 is for the genital wart. So it's also given it can be given to boys.
So will it help then from men preventing men to transmit this? Because this is sexually transmitted, right? There you go.
Sure.
I thought so too. When I saw the question, I'm like, I can only imagine it would be helpful if it helps men not to transmit
Who don't
it to
have
women,
cervix.
right?
Yes, exactly. Okay.
No, you are the men. They're transferring to the woman. So just
Correct.
be careful.
There you go.
Yes.
Yeah, I mean, just like you have sex with this lady,
Right.
and then if you have another one, then you will transmit it to the other lady.
That's right.
I mean,
Exactly.
just be careful, yeah.
Be careful. Is
And
cervical cancer genetic, doctor?
Genetic, mostly it is caused by HPV virus,
Okay.
which is transmitted sexually.
Right. Okay.
So if you have cancer in your
Yeah.
family, it doesn't increase the chances of you catching it.
It increases, but it doesn't mean that just like if your mother has a cervical cancer, it doesn't mean that you will have it too. Just like
Right.
it depends also. As I told you before, just like normally the HPV will resolve itself within 2 years, 90% if your immune system is good. So I mean, yeah, it takes a long way.
Right.
And then if you do the pap test, it will be detected in the early stage.
Correct.
And you will not go into the cervical cancer.
Right.
The pre-cancellation can be cured 100%.
Okay, Doc, we're running out of time, but I've got one quick question for you. What is the recovery rate for cervical cancer here in Indonesia? And if so, what would be the best treatment for those that have caught it at an early stage and perhaps need to get treatment? That's two questions.
Okay, I mean, when it it depends on the stage. It depends on the stadium. We call it the. Once you have the cancer, you can get the relapse, and it really depends on the stadium.
Okay.
And also the treatment is really depends on the stadium.
Okay. And what is the recovery rate
Better
here
not
in
to get it.
Indonesia? How well do people recover?
Sorry, I'm not very sure about
Okay.
that, but when it's already high, it's not very good.
Okay, so there you go. The importance of the vaccine. That's
Prevention.
Exactly. Doctor, thank you so much for your time. We really do appreciate this more
My
in-depth look.
pleasure. Thank you very much. Thanks for having me. Have a good day.
You too.
Bye.
Thank you. You too.
You're so happy. So